when you're foam rolling, you're missing 3 spots. We're gonna show you which ones so that way you don't miss them again.
With our patients, we see a lot of clinical benefits when they start adding in these 3 different areas. They have less pain with running, they have better overhead range of motion,
and also how your low back feels and your hip feels when you're doing any kind of hip hinging, so squatting or deadlifting type movements. Make sure you watch till the end because I can guarantee you haven't seen at least 1, if not 2 of these ways to foam roll before.
Unlock your ankle flexibility and decrease shin splints with foam rolling through your shin. When we talk about the shin muscles, we're talking about this group of muscles here. So you have your anterior tib, your extensor digitorum longus, and your extensor hallucis longus, as well as these peroneal muscles, which you see along the side here. So when you want to make sure to target this part, this red part, this is the muscle belly. When you get down a little bit lower here, you're going to be mostly on tendon or the really thin part of the muscle. So pay attention to this area up here. You want to avoid this yellowish part, which is your bone, as well as here, this fibular head. So you don't want to go over any bone, stick with the muscle. Okay, so John is getting onto the muscle portion of the front of his shin. Okay, so it's not directly right in the center, then you're on your tibia. He's moving just over to the side. You see how he is kind of in a tabletop kind of position, and he places his shin on top of the foam roller, but he's kind of angled to the side in order to get the outer edge of the muscle of the anterior tib. And he might even get to a little bit of the peroneals, the outer muscles of the shin. And he's just rolling back and forth. Once he gets to the lower half of his shin, he's gonna be kind of a little bit more on bone, so he doesn't have to really go to that part. He's just gonna stay up to like just below the knee until about like mid shin or so. This is really helpful to do in addition to foam rolling your calf in order to address shin splints, because the muscles that contribute to shin splints are in the back, like in the calf, some of those deep muscles, as well as the muscles in the front of the shin. John's going to scan through this area for 1 minute. Then after that, he's going to hold whatever area feels more uncomfortable, and he's going to hold there for 15 to 30 seconds. Can you do that? 15? You cannot. Foam rolling through the groin muscles will be helpful for improving squatting, running, any type of lifting mechanics, because this is going to be helpful for improving actually your body's ability to flex at your hip and extend at your hip. So if we're looking here, this is the front of the leg. So here's your kneecap, here's the top of your pelvis. So when we typically think of the groin muscles, we're thinking about here. But let's peel away this quad and some of the other like hip flexors. So we peel that away. And now we're going to expose these groin muscles, these adductor muscles. These create the majority of the mass of your leg. So when you're foam rolling through there, you really want to make sure you get through this like whole section from this lower part just above the knee to the top part of your pelvis. So not only do you see these muscles in the front, they're also, you see them in the back of the leg. So sometimes when people say that they have pain in their hamstring, it's actually more of their adductor muscles. So again, here are your hamstring muscles, these are your adductor muscles. So they extend in the front of the leg and in the back of the leg. These are really important because they're used as hip flexors and hip extensors. So John is having his leg as much out to 90 degrees as he can, and then you see that back leg is straight. So he's trying to keep both sides of his pelvis pointing down. You see though how this right hip is lifting up a little bit more. Some of that is just a product of just his leg resting on the foam roller. If you're particularly tight though, what's gonna happen is your body's gonna kind of turn toward me, but as much as you can, you want to try to keep your pelvis and your trunk pointing down. These are big muscles. So John's going to roll through this entire portion of his thigh all the way down to his knee and then up toward his groin. He's going to roll through this area for a minute to scan through. So you might find that certain spots hurt a little bit more, but make sure though you keep scanning, right? So go through that whole area for a minute. Then John's going to hold wherever it feels kind of tight. He's going to bend his knee and then straighten it. This will be an active release for the muscle. He is enjoying this thoroughly. So this will help to improve that flexibility a little bit more. But don't forgo the scanning process first and just try to get right to this. You're going to get the benefit of scanning first, to release some of the tightness in the connective tissue, and then you can get the benefit of some more localized pressure. Foam rolling through the back portion of your shoulder is going to improve your ability to move your arm overhead, and it's going to decrease your pain. When we talk about foam rolling through the back of the shoulder, we're talking about not only just the lats, but actually some of these rotator cuff muscles too. So here's a more superficial picture. Here's a little bit of a deeper picture. So let's orient ourselves. So here's the back of your deltoid. Here's your lats. Here's part of the trap muscles. So you're going to be rolling through, yes, this lat, a little bit of this deltoid, but if we peel away this deltoid, then we see these deep muscles of the rotator cuff. Here's where you're really going to feel this. So you're going to stick the foam roller right in between here, and you're going to be able to get to these deep rotator cuff muscles, as well as some of that tricep area. So you don't need to necessarily roll down too low onto like the ribs or where the lat is, but really stick to this kind of meaty portion through here. And that is what's going to be really helpful for getting that shoulder to be able to move a little bit more easily. It's going to decrease that pain with overhead movement. John's going to roll back and forth through this back part of the shoulder, kind of on this shoulder blade. So he's not exactly perpendicular to the foam roller. He's actually kind of angled back a little bit. So then that way he can, I'll show you on this other side of his shoulder, he can get through this whole shoulder blade and kind of right underneath the armpit. But he's going to roll a little bit, and he won't move too much, but just like a little bit back and forth. So toward me and then away from me, just to kind of start to get some of those muscles to loosen up at this back part of the shoulder. These muscles, when they're tight, they push your shoulder head forward, which then will throw off some of your mechanics when you try to bring your arm overhead or when you try to bring it behind you as well. After he rolls through an area for about a minute or so, he's going to keep his elbow bent at 90 degrees, and he's going to try to turn his bicep out. He has some limited external rotation range of motion. He should definitely do this. And then he's going to try to turn that, turn in, so back and forth just like this, because that will serve as an active release for some of these back rotator cuff muscles. This one is one of my most favorite foam rolling routines to do before I practice yoga, actually, because it's a really quick way to improve some of that overhead range of motion. Let us know what your favorite lesser known area is in the comments below. Our goal is to be able to provide some free information that you can share with other people, so then everyone can continue to do what it is they love.
Yeah, so make sure you share it with friends, family, and people generally that you think could benefit from any of the things that we share with you. Thank you for watching.